Sounds like President Trump has tomorrow marked in his day planner.
Thursday is our chance to end Obamacare and the Obamacare catastrophe.
The House is scheduled to take up the health care bill that Trump's endorsed tomorrow. Yesterday, he met behind closed doors with GOP rank and file to make the hard sell. It needs 216 votes to pass, meaning there can only be 21 Republican defections or it dies.
The President of the United States came to us and said, we all made a promise to the American people, and we need to keep our promises. And we keep our promise, and the people will reward us. If we don't keep our promise, it will be very hard to manage this.
The bill has been modified to sweeten its appeal to critics on both sides, including allowing states to implement work requirements for enrollees, moving up the date for repeal of Obamacare's taxes on the wealthy, and adding $75 billion in tax credits to help older Americans.
The House bill ends the Obamacare nightmare and gives health care decisions back to the states and back to the American people.
And that's just what worries Governor Charlie Baker, who wrote this letter to the state's congressional delegation yesterday. His office estimates the state could lose $1.5 billion a year in federal revenue by 2022. That would mean 300,000 people on Mass Health, it's our version of Medicaid, would lose their insurance, and almost 200,000 residents who buy coverage through the Health Connector would lose their subsidies. Democrats on Capitol Hill say Massachusetts won't be alone when it comes to facing harsh consequences from this bill.
Despite the desperate last-minute so-called tweaks and modifications, Trump Care will still cause the American people to pay more for less care.
President also threatened GOP lawmakers with a severe backlash from the public if they don't pass this bill, saying many of them will lose their seats in the 2018 election. Joining me are Don Berwick. Don is in charge of Medicare and Medicaid for Barack Obama when the Affordable Care Act was being phased in. He's currently at the Institute for Healthcare Improvement. Good to see you. Heather Cox Richardson, a professor of political history at Boston College. Heather, it's good to see you, too. Let's start with you, because you study Republicans. Several dozen Republicans face pretty tough choice tomorrow, the so-called Freedom Caucus. Do they vote for something they can't stand, or do they vote no and essentially deal a defeat to the president of their own party? Which way does it go?
Well, it's a fascinating lose-lose, actually, and it's wonderful to watch as a political historian, because at least since the 1990s, Republicans have been arguing that, in fact, Americans don't want to have government intervention in their lives. They don't want to have health care. They don't want to have all the things that come along with taxes and with a government that helps people out. And they've been able to sell that because they have not been in charge. They've always been able to blame the Democrats.
Dog catching the car. We've heard
well,
that.
They've caught that, but now they've got the problem of the fact that a number of Republicans, in fact, do want to have everything repealed, stripped right back down, as Ryan wants, down to absolutely nothing. But the vast majority of Americans actually might like that rhetoric, but they also like to have government intervention in their lives, especially in the shape of health care.
Now, even though you don't obviously like to see this gutted, for lack of a better expression, the repeal and replace, obviously details matter, was one of the reasons Donald Trump's president of the United States and why the Republicans control the House and the Senate, no?
Yeah, based on misinformation, though, about the effects of the current law, and now big misinformation on what's going to happen with the law they're proposing.
So you think it was a snake oil deal? They sold them a bill of goods, essentially, is why they put it. Explain to me why Donald Trump is supporting this thing. During the campaign, he said it was going to cover everybody, number one. It was going to make it more affordable. Neither is happening in this version. And equally, if not more importantly, of the 31 states that took under Obamacare the expansion of Medicaid to cover low-income people, 16 of them are run by Republicans, members of his own party. So why is he bought into Ryan Care?
The most generous explanation would be he doesn't understand. Because if it doesn't take long. If you look at the bill, you understand health care, the downside is phenomenal. 24 million people losing coverage. Devastating Medicaid as we know it, leaving people on the street without coverage, the most vulnerable people we have. A gift to the wealthy and a takeaway from the middle class. It doesn't work. Maybe a more sinister interpretation is this is a gift to the wealthy. This is a $1 trillion transfer of resources from the Affordable Care Act go back to wealthy people and away from working class.
By eliminating these taxes on the wealthiest 0.1%, they would, and those people on average would save $190,000. Do you have a thesis as to why Donald Trump has bought in? For a while there, it seemed like he was saying it's Paul Ryan's bill. But he has bought in big time, particularly that meeting yesterday morning and that speech last night.
Well, I think it comes down, in his case, to dominance politics, that in fact they've managed to sell the snake oil, as you're saying, by making the argument that the people who are going to be hurt by cutting the programs they're cutting are minorities, women, marginalized people. And that worked until they really started hitting regular white Americans. And this is the big bill that says to regular white Americans, oh, actually, the federal government's doing an awful lot for you. And the only way that Trump can get out of this now, President Trump can get out of this now, is by continuing to play what he does so well as the dominance politics card. Listen to me, not to your lying eyes. And that, I think, is what he's trying to do. And I don't think he's going to do it on
When
this.
you say listen to me, I'm sure you both saw or read about this incredible editorial, not in some left-wing rag, but the Wall Street Journal today, the presidential credibility, the line that I can't get out of my head. This is the Wall Street Journal editorial. The president clings to his assertion like a drunk to an empty gin bottle. I mean, it's unbelievable language. So do people still believe him when he says last night? I don't mean the hardcore. The hardcore will always be there. Believe him when he says, no, don't listen to this. Over time, it is going to be cheaper. Over time, everybody will have access, et cetera, et cetera. Where are the people on this?
The people I talk to are beginning to understand what they're going to lose. And remember, the Affordable Care Act has crossed the boundary now. It's supported by more Americans than oppose it.
You don't know what you got till it's almost gone.
Absolutely. What the sinister part of this also is kicking the can down the road, so the bad effects don't hit until a little bit later on, like after the midterms or maybe after the next presidential election. I think that's part of the gimmick they're trying here.
What happens? I'm guessing we all talk about what happens if it's defeated. It won't be defeated. I'm assuming Paul Ryan pulls the bill if he sees that he doesn't have enough votes. And as of this afternoon, by the way, Freedom Caucus leaders are saying we have 25 hardcore no votes. If more than 21, as I said, vote no, the thing is dead. So whether it's pulled tomorrow or defeated, assuming those one of those, what do they do? What happens next? I mean, it's not only an embarrassment for the Republican leadership. Mr. Art of the deal, if there's anything that he allegedly could do very well, is negotiate, and he's been negotiating. He's been all in. What happens?
Well, I think you have to separate at this point President Trump off from the bill itself, because he's got his own problems right now with a capital R, right? But the real issue right here is the Republican Party in Congress and the Republican Party nationally, and they have been arguing now all in for close to a generation, but certainly for the last decade, that they must destroy the federal government, that that's what they're empowered to do, that's what they want to do, and it's the Democrats that have stopped them from doing that, and they've made that work. It's not the first time it's happened in American history. We've had other parties who do it. And now rubber is meeting the road. This is their opportunity to do what they said, and most Americans are facing the reality that that is not what they actually want, and this is a crisis for the modern-day Republican Party. I would say it's what's going to swamp and drown the modern-day Republican Party.
Let's come back to Massachusetts. Charlie Baker, we mentioned at the beginning, put out this letter to the delegation. A huge, hundreds of thousands of people losing coverage, potentially $1.5 billion or more. Medicaid funding cuts, subsidies cut, repeal of employer mandate. Is any of this hyperbole? I mean, obviously he wants to make his case. Is he giving a real picture of what the potential impact, should this House version or one like it pass?
Yeah, I mean, he started with a stronger deck of cards because of Massachusetts universal coverage back a decade ago. But yeah, we're going to get hurt hard. You didn't mention the prevention funding cuts. We're doing a tremendous amount with the prevention funds that the ACA made available. That's gone. Yeah, I don't think he's overstating.
And this Medicaid waiver, without giving people a headache at home, that he negotiated purposely a few days before the Obama administration left. I asked you about this. Was this at risk months ago? You said, quote, you bet. Charlie Baker said to me, I don't think so. That's included in his calculation. That could be lost too, which would be another $500 million.
Yeah, I mean, they really want to take away. They want to cut back the federal support to the states.
Getting back to what we talked about just a minute ago, if we can, sort of the national picture, Charlie Baker is one of a number of Republicans. An un-Baker like Jen Brewer from Arizona, 2 million people in her state, big-time Trump supporter, big-time red state, 2 million people on Medicaid in her state, 400,000 of those on Medicaid because of the Affordable Care Act. She says today, this is Jen Brewer, it will simply devastate lives. I mean, so what happens? I mean, all these Republicans are going to be ignored by Republican congressional leaders and a Republican president? Is that what's going to happen?
I started out by saying it was a lose-lose. Either they can continue down the road that has put them in power, this ideological extremism that has been running the party since the 90s, or they can become moderates, but then they lose all the Freedom Caucus people. You cannot continue to bridge this divide between the fact Americans like government intervention, and they are arguing they're going to destroy it all, and this is the moment the two are coming together.
Last thing, speaking of bridging a divide, Charlie Baker said immediately after the election, and I'm paraphrasing, we'd like having only 2.8% of our people not covered. We're going to keep that. He subsequently said if money for Planned Parenthood is eliminated, that's only $2 million. He can't honor that first commitment, even if he intended to. If this happens as is, even if Charlie Baker meant in his heart, we're not going to let people now covered become uncovered, This is you wanted that job. You know what it's unaffordable, right?
Not without raising taxes. We're talking about $880 billion of removal of supports nationally for Medicaid. We take our share of that. No, I don't know how we would maintain. We should, if that were to happen, Lord forbid, we should fight to keep universal coverage here one way or another.
So if you had been governor, you would have raised taxes to cover that?
Health care needs to be covered as a human right. I really believe that if the feds are going to back down, the states have to stand behind it. But no, we need the federal help. We really do.
Dr. Don Berwick, thank you so much.
Thank you.
Heather, great to see you.
Good to see you.
Pleasure. See you both soon.